What's up, guys? Welcome to our YouTube channel, Speak Out Loud. Today's topic is blood pressure. 오늘의 주제는 혈압 측정입니다.
The purpose of our channel is to speak out loud. So we're going to go through some expressions today, and we want you to repeat after what we say.
For some people, I know this video looks pretty easy. But when I first came to the US, everything was challenging. Like interacting with people in English, assessing a patient in English, taking their blood pressure, everything was new to me. 제가 처음에 미국에서 간호학교를 시작했을 때 영어를 잘 하지 못했었고, 그래서 모든 게 쉽지 않았었거든요. 지금 한국이나 아니면 이제 이미 외국에 나오신 한국분들, 이렇게 간호사를 하시려고 계획 중인 분들이 많으신데, 그런 분들한테 좀 도움이 되는 영상을 만들려고 저희들이 이렇게 시작했습니다. So, are you ready?
Yep.
Okay, let's get down to business. So we'll go over how to check blood pressure. Some people wear long sleeve shirts, jackets, or hoodies. So, Carolyn, how do you ask them to take off these clothes?
Can you remove your jacket, please? Can you take off your sweater, please? Can you roll up the sleeve of your shirt?
So this time, you and I will repeat after Carolyn.
Can you remove your jacket, please?
Can you remove your jacket, please?
Can you take off your sweater, please?
Can you take off your sweater, please?
Can you roll up the sleeve of your shirt?
Can you roll up the sleeve of your shirt?
Okay, let's move on.
This way. 혈압을 측정한다고 하니까 영어로는 측정이라는 단어가 measure, 이게 생각나실 수 있을 텐데, I'm gonna measure your blood pressure, 이런 표현을 쓰기도 하지만 I'm gonna measure your blood pressure. It is understandable and it is also correct. 맞는 말이기도 하고 뭐 이해도 되는 말인데, 실제로는 blood pressure를 체크할 때는 take or check. I'm gonna take your blood pressure. I'm gonna check your blood pressure. 이런 표현을 더 많이 씁니다. So, hello, Carolyn. My name is Nurse G. Let me take your blood pressure. Can you please roll up the sleeve of your hoodie? So, I'm gonna put this around your arm. Or
Okay, so we're going to go over a few expressions on how to tell a patient that you're going to put the blood pressure cuff on. You're going to repeat after you, and Nurse G are going to repeat after me. I'm going to place the blood pressure cuff on your arm.
I'm going to place the blood pressure cuff on your arm.
I'm going to put the blood pressure cuff around your arm.
I'm going to put the blood pressure cuff around your arm.
I'm going to put the cuff on your arm.
I'm going to put the cuff on your arm. 이렇게 꼭 I'm going to put the blood pressure cuff on your arm, 이렇게 해도 되지만 또 간단하게 I'm gonna put this around your arm. I'm gonna place this on your arm, 이렇게 하셔도 됩니다. 때로는 이 blood pressure, 혈압 체크가 끝나지 않았는데 아직 이게 진행 중인데 환자가 내 혈압이 몇이냐고 물어볼 때가 있어요. 그럴 때는 wait a moment, 잠깐만 기다리세요, 이렇게 말을 할 수도 있지만 다른 또 간단한 표현이 있어요. So sometimes sometimes a patient asks you what the blood pressure number is even before the reading finishes. Then you can say, wait a moment, it is still reading. Or wait a moment, it is still working.
In some situations, you need to take a patient's blood pressure again. We're going to use 3 verbs to show you how to request this from a patient. Retake, repeat, and take again. So I'm going to say the expressions, and you and Nurse G are going to repeat after me. Are you ready? Let's start. I need to take your blood pressure again.
I need to take your blood pressure again.
I need to repeat your blood pressure.
I need to repeat your blood pressure.
I need to retake your blood pressure.
I need to retake your blood pressure.
You can also use these expressions when you are talking about taking the blood pressure on the patient's other arm. So for example, you would say, I need to retake your blood pressure on the other arm.
Or you can say I need to, or you can also say can I retake your blood pressure on the other arm? 중환자실에서 일하시는 간호사분들 경우에는 혈압 측정을 더 자주 해야 되는 경우가 있는데요. 환자 상태가 안 좋다거나 아니면 혈압 승합제 이런 것들이 투약되고 있을 때는 더 자주 해야 되는데, 혈압 승합제라는 게 영어로는 pressors or vasopressors or vasoactive medications. 그래서 pressors, vasopressors, vasoactive medications. 근데 예를 들면 리보, 니오 아니면 뭐 나이트로 드립 이런 것들이 있는데요. So if you work in the ICU, you may want to retake blood pressure every 30 minutes or every 15, every 5 minutes, depending on the patient's conditions or the medications they are on. So if you have to repeat more often the blood pressure, so how do you say in English?
Okay, so you would say something like, let's set up the blood pressure monitoring to repeat every 30 minutes. Or, let's recycle the blood pressure reading every 15 minutes.
네, 이럴 때는 recycle 아니면 retake 아니면 take every 15 minutes again 이렇게 말씀하시면 되는데요. 캐롤린이 let's set up the blood pressure monitoring to repeat 이렇게 얘기했을 때, 이 경우는 중환자실 안에 환자의 침대 옆에 bedside 마니터가 있는데요. 그러니까 환자 옆에 환자의 그 활력 징후라고 하던데, 환자의 바이탈 사인즈가 전부 다 나오는 bedside 마니터가 있잖아요. 거기에서 자동으로 혈압이 30분, 15분, 5분 간격으로 이렇게 측정이 되도록 셋업을 할 수가 있는데, 그럴 때 쓸 수 있는 표현입니다. Let's set up the blood pressure monitor to repeat every 15 minutes.
We hope that these expressions will help you in your nursing career.
이번 동영상도 도움이 많이 됐으면 좋겠습니다.
간호사 화이팅!
감사합니다.
감사합니다.